Health workers are threatening to paralyze operation in government hospitals to push for better working conditions. The Kenya Medical Practitioners and Dentists Union now says the management of human resources in the sector should be returned to the national government to save it from collapsing. According to the Union Secretary General, Dr. Ouma Oluga, its members were undergoing untold suffering under the county government.
The Kenya Medical Practitioners, Pharmacists and Dentists Union's Secretary General Ouma Oluga says health workers are undergoing untold suffering under the county governments, and efforts to find a lasting solution have failed.
This crisis that's going on, we are soon going to make sure that this suffering ends. And the one way to do that is we're going to withdraw all the healthcare workers, because if Kenya does not need doctors, if Kenya does not need healthcare workers, let us be very clear. We can't let people be suffering in the counties in the name of a constitution.
He recommends the centralization of all human resource duties, such as allocation of salaries, allowances and promotions.
And the counties can proceed to manage the facilities, they can proceed to manage the equipment, they can buy supplies for their people, but when it comes to the doctors, and when it comes to the nurses, and when it comes to the people who treat patients, let us be sober enough as a country to say that this is an emergency.
Oluga is accusing county governments of not being keen to address the issues raised by health workers. Some counties, he says, have even reduced their workers' pay packages.
2,000 doctors have already quit. That's already an indicator of what's going on. Kenyans are dying. We saw cholera the other day, malaria. You saw what happened in Busia with the 28 children. So, the indicators are quite clear that we are failing on healthcare. In fact, let us not subject Kenyan people to unnecessary suffering. Right now, over 420,000 deaths every single year, doubled from 2 years ago. I don't think there is any other indicator that health has failed.
Doctors have been demanding that some aspects of the health sector be handled by the national government, a proposal governors have rejected, saying they can amply handle the sector. The Central Organization of Trade Unions has also supported the calls to have the national government manage the health sector. Trix Ingado, KTN News.